Good morning, good evening, everybody, and welcome to this webinar uh, on transformational leadership. And it's my great pleasure to hand over to my colleague, Darren Smith, who will be doing the introductions tonight.
Yeah, good morning, everyone. Welcome to the webinar on healthcare leadership, transformational healthcare leadership in the era of unprecedented complexities. So my name is Darren Smith. I am one of the program consultants for the Oxford Healthcare Leadership Program here at the SAID Business School at the University of Oxford. So today we are fortunate to have with us two esteemed speakers, Dr. Mark O'Brien, who is the program director for the Oxford Healthcare Leadership Program, and Professor Jonathan Trevor. They will be sharing their insights on navigating the challenges of healthcare leadership in a rapidly changing landscape. So the purpose of today's webinar is really to delve into the concept of transformational healthcare leadership and how it is essential in addressing the complexities we face in the healthcare industry today. So we will be exploring, innovative strategies, best practices, and mindsets needed to lead effectively in these dynamic environments. At the Oxford Healthcare Leadership Program, we are dedicated to developing leaders who can create a lasting impact from within their organization. Our program is designed to empower healthcare professionals to drive positive change, inspire innovation, and foster collaboration within their teams. Our brand, Fostering Impact from Within, encapsulates our commitment to nurturing leadership that ignites transformation at all levels of healthcare management. So without further ado, I look forward to engaging in an insightful discussion today as we dive deep into the world of healthcare leadership. So first of all, thank you again for joining us all, and let's get started. So over to you, Mark.
Darren, thank you so much for that introduction, and good morning and good evening, everybody. It's my great pleasure to be joining you today and to talk about the importance of transformational leadership in an era of unprecedented complexity that we have in healthcare. My name, as Darren said, is Mark O'Brien. I'm the program director of the Oxford Healthcare Leadership Program, and it really is my privilege to be able to share with you some of the thinking that we have at Oxford around healthcare leadership. And of course, I'm delighted tonight that I'm joined by my friend and colleague, Professor Jonathan Trevor, who's the Associate Dean for Practice and Affiliates and a Professor of Practice Management at the school. And the hope tonight is that I'll present some initial ideas and thoughts around complexity and the types of leadership and mindsets needed to drive success in this very complex business of ours called healthcare, and then tap into Jonathan's wisdom as to the practical aspects of aligning and driving performance as a transformational leader. So for me, I thought we would talk about or think about some ideas around value creation, the importance of innovation, the really challenging area of individual autonomy versus compliance as we try to drive reliability and high performance. And of course, as I alluded to, being able to tap into Jonathan's wisdoms around strategic and operational alignment and how this is absolutely critical when we are working in complexity. Anyone who's actually undertaken the Oxford Healthcare Leadership Program would know that this is a slide that they see very often during the program. And it actually comes from Amit Kapoor, who from Tata Consulting Services in the UK, who actually nicely framed the challenges that the world is facing in, if you like, the post-COVID era. But for me, as a healthcare leader and one who thinks deeply about healthcare leadership, I think these four interlocking trends are really driving a lot of the complexity that we've already had in healthcare for many years to a whole new level. The digital tech transition, obviously including AI, but going far beyond that to quantum computing and to everything from technological innovation to service operational enhancement. The energy transition as we move away from fossil fuels. The supply chain transition. In my other roles, I'm a company director of a large healthcare, private hospital healthcare group. And I can tell you as a board member, we were very confronted during COVID around the fact that we had built in many ways systems that were just in time, supply chains. And what COVID exposed, that we needed to have a lot more resilience and a lot more redundancy, which of course comes with cost and complexity. And I think many hospital groups, many clinics, many ministries of health, many healthcare industry groups have moved a lot further along the line to just in case from the just in time that many of us operated in before COVID. And I think also it does vary from country to country, but we're seeing a real change in the way people conceptualize work, the role of work within their lives. And we hear a lot about resilience, a lot about balance, a lot about working from home. And if you just even picking those three things, apart from all the other complexities, we've got a talent transition going on as well. We also have a skilled labor force, particularly in healthcare, that is incredibly mobile. And so we have healthcare workers who face very limited restrictions in their ability to move between systems and between countries and even between geographic parts of the world. So when you put all these together, it's almost like an icing of complexity on top of an already complex adaptive system that is modern healthcare. And so I think for me, there are so many definitions of what effective leaders actually do. But for me as a healthcare leader, this summarizes it for me. This is about value creation. When we come to work in healthcare, whether we be in policy, industry, clinical service delivery, the test of an effective leader is, are they creating value? Is the system getting better? Are the resources being managed more effectively? Is the quality going up? Even if resources are restricted, all of those to me point to that the leader is creating value. And certainly the Oxford Healthcare Leadership Program, that very much drives what areas of focus we explore, particularly around the personal transformation needed to be a leader. I think that anchoring around value creation is very helpful and certainly keeps us anchored. I am a great fan of the work of Dave Snowden. It was done many years ago, as Jonathan will no doubt recall. And you may remember his decision-making model of simple, complicated, and complex decision-making and work. But as I reflect on, I've just finished my 40th year as a medical practitioner, since I graduated as a medical practitioner, as I consider the changes and the experience I've had in working in healthcare systems in over 28 countries, for me, I think this statement summarizes a lot of the problems that I think I see leaders struggling with in this very, very difficult system of healthcare delivery. That, in fact, I think many of us have a bias for using complicated thinking and complicated problem-solving techniques and bring that, if you like, predisposition or bias into the complex adaptive system that many of us operate on. And in fact, I think a lot of the challenges that we have as leaders is the misapplication of complicated problem-solving strategies on complex adaptive problems, decisions, and systems. So for those of you who know this model, you'll recognize this little diagram. And I think the Cynefin model has helped me enormously as a leader as I conceptualize the type of work we do. And certainly when I'm advising, whether it's organizations or governments, I try to do my own little diagnostic and, if you like, slice up the pie of what type of work this organization or unit is doing. And if we go obvious or clear or simple, there's many words that have been used in this model down in the right bottom corner. This is where things are very linear. Manufacturing is the classic one of that, widget production, if you like. And that's where we can very clearly define what is best practice. Moving up the scale, we go into complicated practice where cause and effect are separated over time, but there is a line of a line, a lineage, a predictability. No matter how complicated it is, we can understand it, we can discern the direction of travel, and we can actually accurately predict what success will flow from what actions. But it's when we move into this area of complexity, and particularly complexity adaptive work, that I think we have struggled in healthcare. I think we have been very much influenced by good practice ideas. That if we just think hard enough, if we just get the right model, the right algorithm, that we will produce high quality. And that is true for some of the work we do. An example, elective surgery in many cases is complicated work and very algorithmical and very predictable. Much healthcare industry manufacturing is linear. But increasingly, even I think COVID has actually pushed everything around. Things that were linear or obvious have become complicated. Things that were complicated have become complex. And of course, we're not going to talk much about it tonight. You don't want to complete the circle and move into chaos. So many of us are sort of trying not to move into chaos and stay in complexity. But in a sense, we've moved around the circle, I think, a lot in the post-COVID years. My peer at Oxford, Graham Finlay, who is the program director of the major projects program at the school, has combined the VUCA model, which some of you may know, volatile, uncertain, ambiguous, and complicated model, and combined that with Snowden's work to come up with this nice little diagram that sort of helps us to understand the difference around the ecosystem of a complicated system and a complex system. Complicated systems are different from complex systems in that complex systems are complicated plus. Yes, there is some degree of predictability in some places, but it operates in a volatile, uncertain, and ambiguous environment. And Graham, and I'm very grateful for Graham lending me these wonderful slides for this presentation. But Graham sort of uses a motoring analogy where he talks about the difference between a bicycle, a Ferrari, and traffic. And when he talks about this, he notices that no matter how complex complicated a Ferrari is, you can actually pull it apart and you can actually work out how it works and you can reconstruct it. And there are rules here that if you follow them, you will actually get predictable outcomes. I think in other words, the system is knowable. It can be confusing, but in the case of complexity, it's actually unknowable. There are just things that you can't know, and yet we still have to operate. And so traffic is obviously a complex system. There are so many factors at play that if you pretend that you actually understand why traffic works all the time and the way it does, then I think you're actually being delusional. Some small event that may seem insignificant can actually have catastrophic or major disruptive effects, and we may only find out in hindsight what that actual factor was. So I think the challenge, particularly for funders and for government, is they are often seeking a level of certainty and predictability in healthcare operations that is just not attainable. That in fact there are so many moving parts and so much complexity, so much ambiguity around aims and what we're trying to and how we're trying to do our work, that it can actually be delusional to actually think that you are in control. And that's very difficult for highly intelligent people, particularly people with a scientific background, to work in an environment where cause and effect is not obvious and in fact may never even be known. I think I really like this idea of deconstructive analysis, because I think the deconstructive analysis, the search for answers, is what complicated systems tend to encourage us to do. But I think all of us who sort of love to play in this space of complexity are just as interested in systemic inquiry, which is the search for new questions. And again, in complicated linear systems, whether it's best practice or good practice or whatever you want to call it, the implication is there is an answer already existing, and you just need to work it out and find it. Whereas in fact, in complexity, this idea of getting above the fray, getting above the activity, and trying to see patterns that aren't immediately recognizable and frame new questions is actually a critical element of being a successful leader. So this involves making observations, looking for patterns, asking questions of many different stakeholders. And there's almost a recycling element here. You actually ask questions, reframe the way you see it, ask some more questions, look again. Graham loves to talk about the importance of having a night's sleep and starting again the next morning, and doing, if you like, the slow work of actually trying to see where emergent practice is actually starting to address some of the challenges, rather than assuming that there is a single answer that will solve the problem. And so it's this pattern recognition from the balcony that is so critical, I think, in leadership in complexity. My own conceptualization, and something that I've sort of been thinking about in my work over the last year, as I've tried to explain this, particularly as I have a strong interest in healthcare performance and accountability, is, as I've alluded to, complicated systems are looking for solutions or answers. And complex adaptive systems, I rather think that the balcony work actually presents us with a range of options. And so I think that's quite liberating, because I think many good, intelligent, hardworking healthcare leaders look continuously for the right answer in complex adaptive systems. And I think if you take my line of thinking, I'm suggesting that that's not actually possible. That what you do if you've done the balcony work is you come up with a number of options. And then in a sense, there is an element of gambling or risk management or risk tolerance around this, in that you choose one of those options, what seems to be the one that is emerging as the most likely to produce success, or you might see pockets of innovation or one unit doing better than another, and choosing that option for a period of time and actually supporting it and seeing what happens, and staying on the balcony and actually watching the impact that it has on the system. So I hope that concept is helpful. It certainly has helped me as I've developed my thinking on this idea that in complexity we should not torture ourselves or feel that we are inadequate because we can't find the right answer, but rather that if we do our work well, we will presented with a range of good options that we can actually explore and innovate in, and then continue looking at from the balcony at the effect on the system. Far less elegant is the O'Brien model of the blob of jelly, which relates to system change and complexity. And what I mean by this is that so often I see well-intentioned leaders trying to direct the system in a certain way in complexity by poking their finger into essentially what is the blob of jelly. And all that ends up happening is the blob of jelly will move in a completely unpredictable way, or in fact, this finger will just be absorbed by the jelly. And I like the concept that in complexity, so much about getting things happening is getting many, many fingers, stakeholders, giving their input, giving their ideas, giving their talents, to actually getting alignment of all the fingers on the same side of the jelly and pushing together. Now, not going to suggest that that makes it more predictable, but there's a higher chance that you'll end up going in some sort of direction that you wanted to go in than if it's just you as the lone leader vigorously pushing your finger into the jelly. And I think this raises a question. I'm very keen to get Jonathan involved in this discussion very quickly, because, certainly for the medical profession, and as I mentioned, I've been privileged to have graduated 40 years ago as a doctor, we highly value professional autonomy. It is often gives us a great sense of who we are as professionals, and it certainly can be a great promoter of creativity and initiative amongst team members. But of course, the other side is compliance, which ensures adherence to regulation and organizational standards. And of course, in simple systems or clear systems, compliance and adherence is a critical element for linear system success. Professional autonomy has the potential to be very, very creative in complex adaptive systems, but without alignment can actually become an anchor on high performance. So striking a balance is really critical for driving performance in complex systems. And as I said, this is my particular interest, how you actually drive a high-performing culture in healthcare. And so we know that excessive compliance can actually stifle innovation and responsiveness. And so when we do have to insist on compliance, we need to be very intelligent and wise about what we're insisting that compliance relates to. But on the other hand, there's a really important job for leaders in complex adaptive systems to empower professionals and maintain oversight to ensure that the adaptability that's occurring from the professional autonomy is actually aligned with the success or strategy of the organization. And so for me, strategy is a very simple thing. It's a plan on how we're going to run our business, particularly when our future is uncertain, but we know we want to do well. And we also know we can't just respond as things happen because we probably won't be prepared enough. So for me, strategy is about a mixture of facing uncertainty, being very clear about our intention to do good, but also understanding that preparation and advanced thinking is a critical element in driving success. Which leads me very nicely to my friend and colleague, Jonathan. You've been patiently sitting there listening to me riff on about this. Could I welcome you to the webinar and ask you if you've got any initial thoughts around what I've been saying? And of course, I've got some really, hopefully, provocative questions to ask you when the time is right.
Yeah. Well, thank you very much, Mark, and thank you so much to you and the team for inviting me to speak. And as somebody that lectures on our various health programs, including OHLP, it's really a pleasure to be here. For me, everything you've said holds true, and the magic word for me is alignment, and in particular, alignment in the context of how it is that we create systems and organizations as systems which are fit for purpose, and actually within the wider healthcare ecosystem, whether that's a public system or, for that matter, a free market system or a private sector system. So my particular focus is really at the organizational level. I think one can take a number of different views. One can look at healthcare from an economy-wide perspective, such as here in the UK, the National Health Service. One can also think about it from an organizational level. One can think about it on a sub-organizational basis, such as team or group or individual department. And then finally, one can come down to it from an individual perspective, whether that's as an individual leader or, for that matter, an individual employee. But my particular focus has always really been around the organizational level and what is it that makes organizations fit for purpose, whether they are, for example, hospitals or, for that matter, manufacturing firms, whether they are banks or startups. And this applies across public sector or private sector. And for me, very much this focus on alignment essentially means that all of the moving parts that represent the constituent ingredients of an organization, its strategy, its organizational culture, its structure, its people, its technologies, its operations, all of these different moving parts that all organizations have, but take different forms in different organizations. All of those things need to be arranged in a very careful way, in a strategic way, in order to ensure that the organization is highly aligned and fit for its purpose. And the essential premise is the more aligned it is, the more successful the organization will be. And what you see in front of you is essentially just a very simple framework designed to provoke conversations between leaders of organizations to reflect on their own strategic alignment. And this was published in Harvard Business Review, and pleasingly, really sort of made an impact, because I think this topic of alignment, we hear the term a lot, but what does it really mean, and how is it that we think about it in a critical way? And this really essentially asks two questions to try and get folk to have those high quality conversations in their organizations. And question number one was, well, if we think of organizations as value chains in which purpose is the lodestone, everything is built upon a sense of purpose, how well do our strategy choices support the fulfillment of that purpose? That's really question number one. And when we think about strategy choices, we can include everything from what it is that we choose to offer to the marketplace to fulfill our purpose, to whom we offer it, where, our catchment area, and how it is that we are trying to respond to the needs of our beneficiaries, the beneficiaries or recipients of essentially what it is that we do as an organization. And in the context of healthcare, that means maybe that we offer a general health service, or maybe we as an organization specialize in a particular area. All of those should be intentional and strategic choices. And ultimately, they represent a set of intentions for how we wish to be purposeful in terms of our approach to the marketplace, whether that's the marketplace for private or, for that matter, public goods. The second dimension, which is the x-axis on this chart, goes a step further by saying, well, okay, that's your strategy, and you may have an effective strategy or you may not. You may have invested the time to think very closely or carefully about prioritization, about resource allocation, about the definition of success from a strategy perspective, but have you given equal thought to organizational aspects? And essentially, are we capable of implementing our chosen strategy as we intend? Do we have the right organizational capabilities? Do we have the right people in terms of skills, behavior, knowledge? Do we have the right culture in terms of ways of working? Do we have the right structure that encourages cooperation? Do we have the right technologies? Which is a much bigger concern than simply AI, but that's absolutely a key focus. Do we have the right operations in terms of processes, and ultimately also the systems? And the point being that if we don't, then we are relatively limited in terms of how well we can implement our strategy, no matter how effective that strategy may be. So the point is that all of these components matter, and they must align if our organizations are to be effective. So have a clear purpose, have a strategy and a set of strategy choices that make sense to fulfill that purpose, particularly in the context of the external operating environment, and then equally have great internal choices around how we organize to implement that strategy. And that really, it sounds logical and common sense, and I'm delighted if it does, but relatively few organizations do that particularly well because it cuts across so many different functions and so many different areas. And of course, to your point, exactly as you said, really complexity is often the alignment killer. Creating alignment in complex organizations is so much harder than in simple organizations. So whilst complexity or being complicated may be unavoidable, we should embrace simplicity as a principle wherever it is possible, simply because simple is beautiful. Simple creates greater opportunity to secure alignment and therefore deliver performance. And in the context of the work that we're talking about right now in healthcare, performance doesn't just mean pounds or dollars saved; it means lives saved. And so this really is a critical issue. If organizations aren't effective, then it can be a matter of life and death when you think across public services, but actually across private sector, often it's no less important because organizations are so fundamental to our lives. So when you start, I think, in that way around purpose, strategy, organizational alignment, you start to see that there are these various states. If we have alignment amongst all these things, success is not guaranteed. The external factors can throw us curveballs all the time. Luck still plays a factor, but we're giving ourselves the very best chance of winning. If we have an effective strategy, but we aren't organized effectively to implement that strategy, we have the best of intentions, but ultimately we're more or less incapable. If we don't have an effective strategy that addresses what's happening in the external world, thinking about threats and opportunities, both in the short, medium, and long term, we're boldly going nowhere. No matter how great our talent is, ultimately, the talent isn't being directed in the appropriate way or towards the appropriate ends. And if we have neither an effective strategy, which is to say answers for the external world and how it is that we see our place in it to fulfill our purpose, and if we aren't organized effectively, ultimately we're not long for this world, and we are expiring either quickly or slowly. So this is just a very simple framework that people can apply and have conversations with their teams. And what's really interesting is when you have these conversations, often there's a diverse range of views. So what is the current state? How aligned are we? Does everybody agree? And if we're not as aligned as we want to be, what is it that we can do differently? That can be a great team conversation, but it must be in context. So everything that you were talking about is absolutely spot on, because of course, none of this happens in a vacuum.
Jonathan, that's fantastic. And I've had the privilege of hearing you elucidate this model many times. And I'm always struck every time I hear by some of those critical messages around alignment. I'm sure many of the people online who are healthcare leaders will immediately think of their own organization, their own teams, and sadly probably not see themselves as being in that top right-hand quadrant because of the complexity and because of some of the issues you raised. I think also when I listen to this exposition of your thinking, it's always struck me about how critical getting alignment on purpose is. Again, reflecting my own experience of working in healthcare systems, you can see systems that would, from the outside, would look under-resourced, would look like they shouldn't be successful, who are wildly successful. And when you start deconstructing that, you will find clarity of purpose, usually a leader who is grappling with enormous complexity, but has managed to somehow to make sure that by the time their thinking and message gets down to the dance floor, the messages are simple and clear. And then you will see other organizations that by every means should be outperforming any other organization, a wealth of resources, the best people, who literally are so poorly performing that you wonder whether they're actually achieving anything at all. And maybe it would be better to deconstruct them and start again. So I'd be really interested in your thinking about how you apply this in complexity, particularly given that there are so many diverse and autonomous agents that operate in complexity. And how do you balance that need for autonomy and creativity and innovation with the need, as you say, for making things simple and indeed at times insisting on compliance?
I mean, I think it's a great question, and I'm going to answer that, but also link to a point that you just made. If one views organizations as systems and potentially complex systems, and actually even more potentially complex adaptive systems, I think the really key question is, how do you secure alignment regardless of context? Alignment is a universal principle. We should want our organizations to be as aligned as possible. Alignment doesn't mean standardization. It doesn't necessarily mean compliance. It doesn't mean uniformity. Often it's perceived that way. Alignment essentially means unity. So regardless of context, regardless of the type of organization we are, we could be a hierarchy, which is incredibly conceptually simple. It is singular focus as an organization. It does one thing, it does the same thing, focused on efficiency. Alignment there probably does mean uniformity, because any variation from the scheme is inefficient. But equally, we could be a complex adaptive system. We could be an ecosystem of healthcare providers, ultimately serving a population, multiple independent bodies connected maybe by some hub, incredibly fantastically complex, many actors, many potentially divergent interests. But again, the priority must be around generating unity. But how you go about creating unity in a hierarchy versus that form of ecosystem as two different models of organizing is vastly different. And that's where it comes to your earlier point around leadership, because what you call the balcony leadership, which I think is a great term, I've called the systems leadership, or for that matter, enterprise leadership. And consistently, what I think we find is links between the degree of alignment within an organization and its performance. So you can say, generally speaking, that alignment equals performance, but what equals alignment is leadership, and specifically enterprise leadership, which is to say a group of leaders within an organization who are operating at that organizational level, at that system level, and who are taking a critical view on how it all fits together and how well it fits together, and how potentially the organization as a system, or even a system of systems, multiple independent parts, needs to realign to be fit for purpose in the future. And often my experience is that leaders in organizations, even at the most senior levels, are so caught up in the day-to-day, are so caught up in delivering results, or are so caught up in firefighting, which, by the way, is often, manifestations of misalignment in some way, that they simply don't have the space or don't have the time, or feel that they don't have the permission, which is interesting, to think in that critical way, to step back, and then to, in a very impersonal way. It's not about people leadership, it's purely about systems leadership, to think about how they might reconfigure, rearrange their system to be better in the future, or to be different at least, such that it can maintain a high level of alignment. And so really that balcony leadership, or otherwise known as enterprise leadership, is, for me, is absolutely critical. And it's a very different skill set from being a good team leader. It's a very different skill set from being that charismatic, inspirational leader. It's quite cold, hard, and calculating, because it has to be, because you're effectively, the organizational engineer.
What a great answer, Jonathan. And I suppose, I'm glad you finished with the word engineer, because for me, I also, I love the idea of the learning organization, and I'd like to hear your thoughts around alignment, particularly in complex adaptive systems, because essentially great leaders have fantastic, or design or engineer great feedback loops and learning mechanisms. So they actually embed that into the way the organization works. And I think that's really critical in complexity. Any thoughts on that, and how you see the criticality of feedback mechanisms and learning mechanisms in ensuring alignment is productive?
Yeah, I mean, a great point. And I think one of the things that you can say, and maybe members of the audience can relate to this, um, the flows of information in organizations are often very poor. And this is despite huge advances in information technology, information sharing. And I think you can think about that in two respects. I think the flow of information from top to bottom, but also, and particularly bottom to top, can often be quite limited. Consequently, a lot of the intentions, good or otherwise, of organizations, and by good I don't mean that in a value sense, I mean simply in effective or not, don't make it down to kind of the front line, and so therefore aren't implemented in the way that's actually intended. Too many PowerPoint documents, beautiful PowerPoint decks, but what really matters is providing the knowledge and the information and the capability to those that need it to actually implement strategy well. That's got nothing to do with PowerPoint. It's got everything to do with helping others to make sense of decisions that are made at the organizational level. But equally, it goes the other way. I think there's this view that the traditional view is that the chief executive officer is the most senior manager of an organization and has the most information of anybody. But actually, my experience, of course, and the research would bear this out, it's very lonely at the top. Most chief executives that I work with crave for information and knowledge and insight from the front line, but find it's not easy to get it. And so I think there's something there. That's the almost vertical communication piece, but I think there's a horizontal piece, which is to say, in this more complex adaptive world, for which requires complex adaptive organizations to provide things like excellent healthcare in an integrated and customized way, or personalized way, it requires collaboration across the organization, that horizontal connectivity that I've written about. And that too, still we struggle with overcoming boundaries within organizations. The term silo working will be familiar to anyone. And as much as we emphasize, for example, the value of collaboration or collaborative leadership, it's really hard still, because of course there are good reasons why we have structures built into our organizations for efficiency purposes, for specialization purposes. So I think that's maybe one of the key points about alignment, is that does not occur by accident. It is not a naturally occurring phenomenon. You are not going to secure alignment. You're not going to be lucky enough to be aligned by accident. And if you are, it won't be for very long, particularly in a changing environment. Alignment, strategic alignment, only occurs through the quality of an organization's leadership, through the choices that they make as a result of the questions they ask and the conversations they have. And we should really hope that those conversations are structured and constructive, and really addressing what's important. And that's the first step in terms of how you start to move the needle on all of this stuff. Having a critical reflection on ideally how should we be to be fit for purpose in the future in our particular context, and actually how are we and how do we close the gap. And that often is a scary conversation, but it should also be an inspiring conversation, because that's how we do better.
Jonathan, one of the joys of being the program director of the Healthcare Leadership Program is we have the opportunity at the program to sort of have these tremendous theoretical ideas, but we've also got the time to then start deconstructing it into purposeful action and how you actually implement this great thinking into something that you can take back to work in your own environment as a leader. So it's been fantastic hearing your reflections. I'm conscious of the time, and sadly, Jonathan, I know that you've got another appointment. You'll have to leave us in about 5 minutes' time. But Darren, were there any questions in the chat specifically related to Jonathan's powerful insights that we may be able to ask Jonathan before he has to leave us?
Yeah, absolutely. So we do have two questions. I'll start with the second one, which might be sort of for both of you. So I'll just read out the question. So increasingly, we are being encouraged to collaborate, having previously, been competing with each other, and this includes the combining efforts of, within local authorities, voluntary and independent sector providers to create value. So policies and regulatory frameworks don't make this easy. So how do you see leaders adapting to the new ways of working? Is the question.
Jonathan.
I think this is a fundamental issue. Let me give you an example from another sector, local government here in the UK. A particular local government organisation with who I have worked extensively in the past provides every type of service, from education through to roads, through to social care, infrastructure, all of these things. And in the past, their particular focus was to be the professional deliverer of public services, all public services at the local level, for everyone. And in the future, I think it will have to be different, because they are moving to more of a commissioning model, which is to say, to be the professional commissioner of public services delivered by other bodies, from the not-for-profit, other public sector, but also private sector, and to do so in close collaboration with police, with healthcare, and various other bodies as well. And I think that speaks to this incentive problem. I think particularly in complex environments like public services, whether it's local, health, central, or for that matter, defense, I think increasingly relying upon our own internal resources isn't viable. So how is it that we can bring in partners through which to deliver better services? And then the challenge becomes, from an enterprise leadership perspective, how is it that we can create that ecosystem in which incentives are aligned? And I don't just mean simply financial incentives, but rather understanding what motivates each and every single partner organization, and align that specifically to the requirements of our customers or end users or patients or community or citizens, whomever. And there's no easy answer to that, but I think there has to be a key competency. There's no easy answer because it will look different in different contexts. So I think it's really beholden upon healthcare leaders, or public service leaders, or whomever, to develop that muscle to think critically about which services they're delivering, how they're delivering those services, and through what means are they delivering those services. Is it through internal resources or external? And if it's external, how then to align those resources. And that basically means developing really great political skills, albeit politics with a small p.
That's great answer, Jonathan. And I was recently privileged to um, address the European patient safety regulators, and it was very challenging and great conversations. But I put out a challenge that sometimes regulators don't actually think about what the impact of their actions and their decrees are at the ground level. They can make logical sense as long as you're not getting information flows back from the coalface. And I think I love the idea of great leaders in these areas being conveners, not only collaborators but conveners of ideas, conveners of interests, conveners of outcomes, and facilitating those conversations. Because traditionally, healthcare has been very much, if we go to an accounting model, very much input based. And I think we're seeing around the world people saying, well, that's really not fit for purpose. Healthcare has to realign to be output based and work backwards from the outputs we produce rather than forwards from the inputs we currently have in our systems.
And if I may, Mark, I'm just going to jump in because I think Ankit Khanna has asked a great question or made a great point. The NHS, National Health Service here in the UK, is very large and complex. Is it possible at high level to align even the leaders, let alone the team at the bottom? And in many respects, I think the research is entirely conclusive. Unless you have an aligned leadership team, you can't have an aligned organization. The kind of very cliche answer is that a fish rots from the head. And so I think it's really essential before you do anything that you have an aligned leadership team. And I mentioned earlier that complexity is the alignment killer. The antidote to complexity is sophistication of leadership. So where we have complex systems, it means that we need even more sophisticated leadership than we might otherwise expect in an organization. And so that's really the first point of call. Are we able to match complexity with the sophistication of our leadership to be precisely the convener that you just mentioned, to be the analyst, to understand and make sense of that complex organizational environment, and of course, how it aligns to the external environment?
Jonathan, it was such an important reason for my alignment with Oxford. I felt that a healthcare leadership program, being at a business school where we could actually tap into the expertise of people outside healthcare, was absolutely critical and a key thing that needed to happen. And so it's one of the joys of my role that I do get to be challenged continuously by people who have expertise outside of healthcare. Jonathan, I'm conscious of the time. Your generosity has been amazing, my friend, and thank you so much for your powerful insights. And Jonathan is one of the many powerful speakers and facilitators on the Oxford Healthcare Leadership Program. And Jonathan, we always value your insights, and everyone seems to go away with your session doing some powerful work and deconstruction to get everything aligned for when they go back home. So thank you, my friend, for that wonderful contribution to our webinar.
My pleasure. Thanks so much, and I've really enjoyed it. And I hope everybody has the opportunity to take something away from this and reflect a little bit on their own organizations. Thank you so much, Mark, for inviting me.
Thanks, Jonathan. And Darren, I'm conscious that you said there may be a second question. I won't have Jonathan's expertise, but I may be able to give some thoughts on it.
That's fine. We've got a couple of questions and just about 5 or 6 minutes left, so we'll try and answer them as best as we can. So the first question that did pop up was about AI. So I know that this is a trending topic, and we do discuss this on the leadership program, especially in one of our sessions. So the question is, how are hospitals organizing themselves in this sort of new era of AI? So if there's any comments that you have, in regards to that, Mark, that would be great.
Yeah, no, thanks, Darren. A great question. Look, any expertise I would have in that space is in the governance of AI.
Yeah.
Obviously, with my board roles and obviously in my leadership development roles here at Oxford. I think that it's that classic two-edged sword, isn't it? The potential is just enormous. We're seeing uptake, from clinical note taking to preparation of policy papers. Everything is being, people are accessing AI in a sense, seeking forgiveness rather than permission from their organizations. And they're sending information from their phones to wherever all of that data goes to, and getting something back. And so, look, the potential is enormous, and everyone's very excited. As you mentioned, we have one of the world's experts in AI and healthcare who leads an amazing session at the OHLP. I think there is then the downside, the dark side of data governance. How is this going to be used? The whole issue of hallucination is really worrying, and of course, two critical elements. Firstly, that we're not sure what the demographics and of the data mining is when it comes to healthcare. So, is it when AI produces thinking around healthcare policy and public health, what populations have they accessed? Have they accessed, for example, mainly Caucasian middle class people, or have they accessed, and that may be, if that's true for that particular data set, is that true for people who live in a completely different culture with completely different socioeconomic drivers and perhaps even different patterns of pathology? The second one is the concern that AI may become a little bit stuck in time. We're certainly in the governance space. We're seeing, and some of you would know that is it deep state or deep secret or another? China has released a very powerful, simple AI model today. I think if we look outside of healthcare, many professional firms and many organizations are taking their AI, open access AI models and taking them behind their firewalls. So they're using them, but providing the data only to the AI model behind their firewall. So that data is not being uploaded for general use. And there is a risk that, in fact, AI could get stuck in time where it's analyzing the data that it's got over and over again and not being updated as increasingly large organizations take their data and the use of AI behind their firewall. Now, I certainly claim no expertise on that, but I think there is really, we should be incredibly excited about anything that streamlines, makes processes more efficient, the note-taking abilities, the summarizing abilities in clinical conversations, exciting design, all of those things are wonderful. But I think we just need to have a bit of a question mark in the back of our mind around how representative is the data that's being used? Is it up to date? Is it being progressed? And secondly, is it the risk of hallucination and manipulation?
Okay, no, thank you very much, Mark, for that. One more question we have is about, so most clinicians are brought up in a very linear sort of cause and effect mindset. So are there any suggestions on how we can support emerging leaders to make the leap to complex adaptive thinking?
Yeah. Well, it's certainly what we're trying to do at the healthcare leadership program. So you're right. That's a question that I probably can't give a balanced answer on, Darren, because my own view is that this needs quite some development and quite some time for reflective thinking away from, as Jonathan said, busy practice. And one of the joys of my role is to take these wonderful clinical leaders and non-clinical leaders for, in a sense, to a retreat environment for 7 days where we can do that deep thinking and work. Because I think, as Jonathan said, alignment doesn't happen by chance or by luck. I don't think the deep personal transformation into someone who's effective at dealing with complexity, particularly those of us who've had a scientific background, this work can look very messy. The unpredictability, the blob of jelly doesn't look very much like a scientific experiment. And so I think, as you well know, we have 2 streams of the program. The first is the technical skills around strategy, innovation, AI, performance, accountability. But there's this whole second stream, which is about the personal transformation that you need to make. And as you know, Darren, you've sat in on the program. One of the things I say in the first 10 minutes is that almost by definition, if you've arrived at the program, you have a lot of unlearning to do. The fact that you've been successful and get yourself to a program like ours means that there's a lot to celebrating your success, but there's a lot to unlearn in the personal switch from being a very, very competent clinical leader in particular to someone who is competent and who is able to drive alignment and performance in complexity.
Okay, thank you very much, Mark. We are coming to the end of the webinar now. I know we have a few more questions, but unfortunately, we're not able to answer this just due to having to finish now. So I would just like to sort of thank you all for joining us today for this very insightful webinar on healthcare leadership. As the program consultant for the Oxford Healthcare Leadership Program, I am thrilled, first of all, to see such engagement and interest in this crucial topic. I want to express my gratitude to our esteemed host, Dr. Mark O'Brien, and Professor Jonathan Trevor, who's had to leave slightly early, for sharing their expertise and valuable insights with us today. Your contributions have truly been, both enlightening and inspiring for myself and for everyone who joined us today. I'd also like to extend my thanks to our attentive audience for their active participation, thoughtful questions. The engagement you've made to this webinar has been meaningful and enriching experience for both myself, Mark, and for all of us here today. So as we do come to an end to the webinar, I want to remind you that the Oxford Healthcare Leadership Program is accepting participant applications for the upcoming sessions. The next program dates are the 2nd to the 7th of March, and the next one is the 5th to the 10th of October this year in 2025. This is a unique opportunity to enhance your leadership skills and really make a positive impact in the healthcare sector. So once again, thank you for all being parts of this webinar. Your presence and contributions are greatly appreciated. So let's continue to strive for excellence in healthcare leadership. Thank you very much to everyone who's joined us today, and have a wonderful day.
Thank you, Darren. Thank you, everyone, for attending, and we'd love to see you at Oxford. I hope this has piqued your interest in coming and spending time with us and doing a really deep dive both on your technical skills as a leader, but also that personal transformation journey. And it's been a privilege to be part of the conversation. Good morning and good evening, depending on which part of the world you're in.